but you know, they can't afford to rebuild and no insurance or anything. Not that
like what they did
insurance
with Louisiana, and with the Katrina.
And what's it? There was another one part as well. Like Hawaii, like Oprah saying like, let's get together. It's like, bitch, you've got billions.
Send some money.
You know, suddenly you need some money to be sent to somewhere that you live. You actually live in that area as well. You've got a house. You know what I mean? You could afford to build up everybody's house back. Exactly. But no, because we all know that they want a way. They want the original people to get out because now they ain't got a house. And they'll start rebuilding and as they say, gentrify it. You know what I mean?
Sounds about right.
So yeah.
Welcome to My Time to Talk. What we're talking about today.
And today we're going to talk about that disastrous thing with that the poor lady that was treated despicably.
Yes. Are you able to call the anesthesiologist? Someone is coming to take you to labor and delivery. That's not what
We're talking maternity today and how Black women have actually been mistreated in the maternal situations. You know, there is loads of. But when you're having a child, you kind of think like, well, they know what they're doing. Do you know what I mean? They can't be so inhumane that they'll be treating me bad for some reason that, you know, like connected to my skin color. No, can't be that. You know what I mean? But there is so many incidences of it. It can't be that it's not that anymore. Do you know what I mean? It's like that one showing in America recently. You know, she's sitting there in massive amounts of pain, and the woman is like Charlie Kirk's, no empathy. You know what I mean? Like, well, we won't be empathizing, asking the same questions time and time again. Did you notice? She was asking, how many children have you got? And she asked again.
Surely all of this information you would have
be done after you've taken care of the lady.
You would have already had, though. Like, this woman is in the last stages of her labour. You know they've already got all that information. So she's been deliberately obtuse, isn't she? She's going out of her way to not have to deal with the woman in active labour. But it's like, if you don't want to do that job, then don't. Like, those types of jobs, nursing, midwifery, like they're vocations. Do you know what I mean? Got to be. So if you're not interested in helping people or working with communities or certain communities, then don't take up them type of jobs. This isn't fucking Walmart. Do you know, this isn't your local Aldi or whatever, like where you could just be dashing around cans, because that's what I mean. People don't see the after effects of births like that. Do you know what I mean? Like, if by the grace of God you do make it through, thankfully this lady was okay and her son was okay.
Yeah, but they're saying that they're not even sure if he hasn't got ramifications for the years coming. Yeah, because he was born with his eyes open, and I thought that was very because I've had both my children were born with their eyes open, and you know what I mean? Like, and it says that he could have actually experienced post-traumatic in the womb.
I don't know.
Do you know what I mean? Because his mum is in dire straits.
Well, they know that they can feel the thingy. Like, that's why they say don't stress through your pregnancy and that, because they know that the babies can like feed off the emotions of the moms. Do you know what I mean? So they know all of this when it comes to their own. And obviously we have got a few stats. That was America. And so when we was looking at the American stats, US stats, black women experience high maternal mortality rates, 2.5 times higher than white women, which is the equivalent of 49.5 deaths per 100,000 live births, compared to 19 for white women. But what I thought was crazy is that when you got to our stats, our ones
In
is
the
3
UK.
in the UK. Yeah, we're 3.5 times more likely to have a higher mortality rate or to die basically during childbirth or in the first year after pregnancy than white women. So I was saying to you, and I wonder if ours is higher because we actually haven't even got the option normally of
go to another hospital.
of doing private healthcare, isn't it? Like we obviously usually would have our children on the NHS or through the NHS. So is it that our mortality rate is even higher because
we've got no choice?
We
about
don't
the
have choice. Like it all depends on where you live. Which would have been more interesting as well, actually, to see like what areas probably had higher thingies than other. Because I bet, like in the more affluent areas, their mortality rates are probably a lot lower than, the more poverty-stricken areas. Yeah.
But then again, actually, that's sometimes not the case. In the case of like the hospital, if a hospital has racist, or it could be anywhere. I mean, what's it?
I think if they're racist, then it doesn't matter, does it?
Going to
and that's what I was thinking.
Because
like I was looking at the reasons of this, and so across the board, basically, this is UK and US. The reasons is usually dismissal of pain and symptoms, systematic racism, lower quality of care, and then obviously the mental health impact, like stress and anxiety for the black pregnant women. So a lot of the times then they, as you were saying, they won't advocate for themselves as much because you are in a vulnerable state, aren't you?
And it's a lot of pain.
Yeah, so this would be like racism, like overt and implicit racism leading to neglect. Then obviously on top of that, the medical bias. So things like black women are more tolerant to pain and things like that.
And where do they get that from?
Well, that guy, he was glorified up until just recently. Sims, I think his name was. I can't remember the name now. Something Marion Sims or something, and he was the father, the godfather, or the father of gynecology. And he basically experimented and tortured for, like I say, black enslaved women during the 1800s, and they like revere him right up to now. But he wouldn't use anesthetic on these women, and like literally, so you can imagine the amount of pain that they must have been in going through these kind of things. But it leads on, it carries through because obviously he was, as I said, revered up until very recently. They had statues of him up in, in America and everything, for what, they call his great research and contributions to gynecological health. But it's on the back of black women and black women's pain, do you know what I mean? And then that follows through then, like they don't need that. Or also like the war on drugs thing, like when they'll think, they're black people are all drug addicts or whatever. So they're only looking at after the hard drugs, like that's why they're screaming down the place or whatever. They're not actually in pain. Really, they're just looking for morphine or something.
But really, when you think that a person in slavery is probably going to dumb that down type of thing, like the woman is going to, masses going to be experimenting but not even knowing that word. Massa's going to do something and I've been told to shut up, so I'll just bear the pain type of thing. But that is the only reason, because there is no childbirth unless you've had a few. And even when you've had a few, you still can have problems in your pregnancy.
Every pregnancy is different. So it doesn't matter whether that was her first, whether that's her fucking 10th. Do you know what I mean? Like she deserved to be treated exactly the same way as if it was, her first. She's a human being at the end of the day. You can see she's in massive amounts of pain. And as I said, it just wasn't surprising to me. Like I've had my fair amount of children and I've been treated appallingly also in labour. Do you know what I mean?
Yeah.
Knowing that I am in labour and being told, and it's not,
You're not in labour?
I've got to say this as well, like sadly, it's not just white healthcare or physicians either. Like it's black people also.
Yeah.
I had a black woman come and palpitate my belly, and she was so rough, literally. And she's like, well, you're not in labour. And I'm like, well, I am in labour though.
Yeah.
You know, I've had children before. I know what labour feels like. Well, we'll send you down to scan, but then you're going to be discharged. Like literally just so dismissive. And if I was discharged, if my baby didn't come that day, my baby would have died.
Yeah.
Literally, because she wasn't breathing when she was born. Now imagine that woman was going to send me home.
Yeah.
Do you know what I mean? After bleeding for 10 days. That woman was then going to send me home, telling me about, oh, well, we're just going to check that there's enough fluid in your uterus, and then you can go home.
Yeah.
Do you know what I mean? So it's for the grace of God that my child actually came within those couple of hours that they were trying to discharge me. Right up until there, I'm ready to push. They're telling me I'm not in labour. Like you just can't.
Yeah.
You just can't with these people.
Because
seriously.
even if it was your first child, I mean, like my first child, the same things happened, and that was back in the day. Do you know what I mean? Which, like, after you've lost that child, because he died on, you know, rest in peace, is like he died at birth. And they told me afterwards that, oh, well, we could have actually, if we'd have done a scan, we could have told you that he wouldn't live, you know, past a certain amount of time. But it's like, it's all right for you to say that, but you don't have no idea about the fact that when a woman has a child, she sees that child as a child from the get-go. Do you know what I mean? From the, oh gosh, I'm pregnant. You know, we see that as a child, even if they want to say you can have an abortion at 28 weeks. There is, like myself, people who feel like that was a child, that was my child that died, and through your neglect. Do you know what I mean? And that was back in the 80s. So if we're having the same treatment as we had in the 80s, what is happening to this country? What is happening to any country that would treat a woman who is in active labour badly? You know, what is that all about?
Exactly. You wouldn't treat an animal that way. Like, literally, you wouldn't treat an animal that way. The way that, like, we saw another one in it that you showed me recently where the woman is just blatantly like, I'm not, what did she say? I don't treat people like
patients. Patients, like, I don't
like
treat
them.
You keep saying go somewhere else.
Sir, I already told you we have
Policies? She's in pain. What kind of hospital?
I don't touch certain types of patients.
Patients like you.
Basically, like talking about black people.
This is 2019, actually. Literally. So that means we're 6 years, only 6 years away from the fact that some other person got treated like that. And that in that case, the woman had to go to another hospital. You know, I actually I was saying, I don't know if it was to you, that that if she'd have had a man with her, probably, I'm talking about the recent one, maybe things would have been different or something. But
this morning, a Chicago woman is demanding answers from a hospital she says discharged her while she was in labor. 38-year-old Mercedes Wells says she was having contractions 1 minute apart and knew the baby was coming, but a nurse sent her home.
I was in excruciating pain. She seen me in pain and agony, and I guess she still perceived me to not be in labor.
The family sharing this video of Wells being wheeled out of the hospital. She then gave birth 8 minutes later in her truck on the side of the highway, her husband delivering their baby himself.
It's totally God's grace. I was scared. I didn't know what to do. I don't have any medical license or anything to deliver a baby.
Wells says she spent 6 hours at the hospital but never saw a doctor. She blames racial discrimination.
I was stripped of my dignity as a person because I was treated less than an animal.
Can we agree that a woman in active labor should not be sent away without first being seen by a doctor?
This one that they showed did have a man with her. And
because if
it
anything,
didn't make
then
no difference.
they'll say that he's just being aggressive, and then that's even more reason why
Yeah,
they want to
like
take you out.
security,
Yeah.
you know.
But yeah, like we've had our fair share as well. There was that lady that died as well recently, due to poor maternity health.
Yeah.
You know what I mean? Babies, mothers, like we've seen it. It's a trend. This is not an anomaly, whereas it should be an anomaly, you know, in this day and age, with all of the, you know, advances in medical science that we have, and we can see this and we know that about babies and mothers and what the body can do. There's just no excuse. Like, it is literally down to racism and neglect, and it's purposeful. So really, not only losing jobs, like people need to be put on some charges, and then maybe they'll stop treating black women this way.
Yeah, because really, I feel that even though they close down these places, they, you know, make people aware that they've done something about it or something like that. Really, at the end of the day, if it's still happening, you haven't done enough. You haven't done enough. And I would say that I know that there is white women that are in the same position. They have certain things, you know, but we are emphasizing on the black side this time, because it is tragic that we're in 2025 and children are dying. Children are dying in childbirth. You know what I mean? Women, I mean, you've got to start knowing that a woman kind of knows her own body. So don't tell a woman that she's not feeling pain and it's unusual pain because it's not baby pain type of thing. Or it's not, I'm going to deliver this child right now. There could be something wrong that you have to take into account. You've got to stop being racist is the only word I can think of. Is racism, you know, pure racism. And like, yeah, you don't care. You know what I mean? You obviously don't care that black children are dying. Otherwise it wouldn't still be happening in 2025. Obviously you don't care, but you know, like, we will not just sit down and let this thing keep happening. We've got social media now, and it's going to be weaponized against the people that are treating black women like this. You know, it can't keep getting away with it.
Yeah, definitely. But thankfully this lady was okay. As we said, prayed that her baby is okay as well, her son. You know, we didn't even get into how the other nurse treated the baby, because that woman just dragged the baby up by his arm and like gave him a shake and then just plopped him back down on the bed. I was like astounded. So yeah, must do better. Definitely must do better. But yeah, I think we'll leave it there for now. Yeah. Right, like and subscribe.
Like and subscribe. Come on. We need subscribers. Tell us if you want us to discuss something in particular. I'll do the research. That's for sure.
Oh yeah, definitely. Good thinking. All right then, until next time.
Like and subscribe.
Like and subscribe.